I'm excited to share with you today what Iowa State University Extension and Outreach is doing to help promote the health and wellness of older Iowans. Iowa State University Extension and Outreach has nearly 1,000 faculty and staff on campus and across the state in 100 county offices that serve our 99 counties. Human Sciences Extension and Outreach translates the research and creates accessible educational opportunity for citizens across the state. In the last year, the Nutrition and Wellness team has reached over 1.5 million Iowans through our in-person and online programs. During today's presentations, I will discuss 3 of our Extension and Outreach Nutrition and Wellness programs designed to serve older adults. The programs I'll talk about today were designed by applying the social marketing theory framework. The social marketing theory applies commercial marketing concepts to analyze, plan, implement, and evaluate health programs to influence the behavior of target audiences. The social marketing theory utilizes a continuous cycle of planning and strategy, selecting channels and materials for education, developing materials and pre-testing, implementation, assessing effectiveness, and gathering feedback to revise the program. For planning and strategy, I have utilized interviews, focus groups, and surveys. For steps 2 through 5, I have conducted pilot studies that involved as few as 60 participants to statewide impact assessments with more than 300. For all of these, we have used a mixture of program-specific evaluations and validated tools. Nationally, up to 1 out of 2 community residing older adults is at risk for malnutrition. A 2012 to 13 Iowa study that included 300 adults aged 60 years and older found nearly 1/4 were at risk for malnutrition or were malnourished. Those who were at risk had lower intakes of meals, protein-rich foods, produce, and fluids. In a multi-state study that I conducted, we evaluated the nutritional risk of older adults attending community-based wellness programs. In this study, over 3/4 of all participants were classified as at nutritional risk or at possible nutritional risk. The greatest number of participants for each state was classified as at possible nutritional risk. In this study, the majority of participants had a low mean dietary intake frequency of protein and dairy across states. The processed meat intake frequency was also lower, suggesting a lower intake, which is actually desirable due to sodium. There was a moderate mean intake frequency of whole fruits and juice, total and whole grains, vegetables, and added fats, sugars, and sweets. Among the 3 states collectively, the mean lean protein and dairy intake frequencies were considered low or unfavorable. Both are good sources of protein. Low consumption of lean protein is very concerning, as sarcopenia, which is the progressive loss of skeletal muscle mass accompanied by a reduction in muscle strength or performance, is common among older adults. It is estimated that nearly 1/2 of U.S. older adults are affected by sarcopenia. These data suggest older adults may benefit from nutrition education programs that focus on incorporating more protein-rich foods into meals and snacks. In addition to the nutritional risk of older adults, it is important to understand their risk for food insecurity. Food insecurity is the limited access to a safe and nutritious food supply. Poverty amongst older adults is on the rise due to the economy and increased cost of living associated with aging, such as healthcare costs. In fact, nearly 3 million households of older adults aged 65 and older experience food insecurity in recent years. In addition, more than 10 million older adults face hunger annually. Despite these numbers, 60% of adults aged 65 and older are eligible for food assistance but are not enrolled. Being unable to purchase adequate food or having food insecurity is correlated with poor health outcomes and can be reduced through food assistance programs. Thus, it is critical that community healthcare providers promote awareness of community food and nutrition programs that can help support food security, as well as general nutrition and wellness education. This is where ISU Extension and Outreach is valuable. Within the area of nutrition and wellness, we have 3 main programs designed for older adults. As I described on the previous slide, senior hunger and food security are key nutritional concerns in Iowa. 2 of these programs target these areas, including NEWS and WIN. The Stay Independent program addresses the nutrition and physical activity needs of older adults. The dietary practices of older adults with limited resources are placing them at higher risk for poor nutritional status, risk of health problems, and functional limitations. Community-based food and nutrition programs aim to improve food security and help older adults understand the role that nutrition plays in maintaining and improving their health. The Commodity and Supplemental Food Program aims to improve the health of adults aged 50 years and older who are classified as low income. It provides foods to help clients supplement their diets with United States Department of Agriculture foods, or those commodity foods. It also requires monthly nutrition education to be provided. To participate in the Commodity and Supplemental Food Program, a person must be a resident of the designated Indian tribal organization, state, or the District of Columbia. It requires an older adult to have a household income less than or equal to 30% of the federal poverty guidelines. States may also require that participants be at nutritional risk. Nutrition education with seniors, or News You Can Use, is a monthly newsletter-based nutrition education program with taste testing for adults aged 60 years and older who are participating in the Polk County Commodity and Supplemental Food Program. The goal of the news program is to enhance participant knowledge of the relationship between good nutrition and good health, and the ability to alter present food habits to include supplemental foods along with other nutritious foods to improve their overall health. When I say supplemental foods here, I'm not talking about nutritional supplements. We're talking about the supplemental foods that the USDA is providing. So these can be dried beans, peanut butter, different types of whole grain cereals, pastas, etc. The news program reaches nearly 4,000 older Iowans in Polk County annually and has resulted in enhanced nutrition knowledge, improved food choices, and an inclusion of recommended budget strategies. In addition, our nutrition and wellness specialists who are across the state of Iowa share this newsletter in their counties too, so it reaches far more than those who are enrolled in the Commodity and Supplemental Food Program. I'd like to take a minute to share with you the outcomes that we've collected thus far with the news program. To date, nearly 4,000 evaluations have been completed between summer 2014 and this past winter. The majority of respondents have been female between ages 60 and 69 years and have attended at least one recipe tasting in the last 3 months prior to when they completed the evaluation. The respondents have reported making food choices based on the newsletter information, finding the food assistance and/or budget information that's included in the newsletter to be useful, have enjoyed the monthly recipe samples, and have reported making at least one of the recipes that we included in the newsletter at home. So what these evaluations have shown us is that the news program is effective in promoting informed food selection and awareness of food assistance resources, and encourages the use of commodity foods through new recipes among older adults age 50 years and older who are enrolled in the Commodity and Supplemental Food Program. Our other program that is designed to address food insecurity is Wellness and Independence Through Nutrition, or WIN. WIN is a food assistance outreach program funded through the USDA SNAP program. Participation in the Iowa SNAP program is called food assistance, can help midlife and older Iowans who are at risk for malnutrition and or who are food insecure overcome the financial barriers to consuming enough food necessary to improve and or maintain their health. In Iowa, as I said previously, SNAP is referred to as food assistance. Food assistance is not a nutrition program, but rather a hunger prevention program. So a lot of times a critique of SNAP is that people are allowed to choose whatever foods they wish, but it's because it is a hunger prevention program and not a nutrition program like the Women, Infant, and Children's Program, or WIC. In 2014, 2 in 5 adults age 50 and older had a food-related hardship, and 1 in 5 had challenges purchasing nutrient-rich foods. Food assistance can be used to buy any type of food that is intended to be prepared and eaten at home, as well as plants and seeds to grow your own food at home. There are many possible places to use food assistance in addition to a grocery store, including Schwann's, farmers markets, Meals on Wheels, and convenience stores. Participants cannot use food assistance to buy foods that are already hot or meant to be eaten in the store. Participants can also, SNAP is not allowed to buy vitamins, medicines, or any other non-food items. As mentioned earlier, most eligible older adults are not enrolling in the food assistance program. The National Center on Aging states that many aging adults are hesitant to apply for food assistance because of the myths surrounding those who qualify and how the program functions. The key to overcoming the negative stigma that is associated with food assistance is to emphasize the benefits that food assistance offers, while also addressing the myths that create the negative feelings about it, as well as the perceived difficulty of applying for it. The WIN program is designed to overcome these barriers by using strategies to lessen the stigma associated with food assistance, including promoting it as a wellness program through a variety of outreach efforts. The WIN program is designed as a wellness program. In focus groups that I conducted around Iowa, amongst midlife and older Iowans, revealed that independence was the biggest motivator for electing to participate in a wellness program. The WIN program uses this motivating factor throughout its curriculum. The long-term goal of the WIN program is to reduce hunger and food insecurity in underserved midlife and older Iowans who are eligible for, but not yet enrolled in, the food assistance program. The WIN program promotes awareness of how food assistance can improve nutritional intake, improve quality of life, and also how it actually can help the local economy. For fiscal year 21, the WIN program will be promoted in 28 counties, including several new counties in which we have not yet previously offered WIN. Our outreach efforts are designed to promote food assistance outreach efforts towards Iowans age 50 years and older, increase awareness of food assistance and how it can help maintain good health and independence for midlife and older adults age 50 years and older, and increase the number of eligible Iowans ages 50 years and older in applying for food assistance. The WIN program was originally designed to be a volunteer-led initiative that promoted food assistance awareness via in-person interactive sessions. However, after many years, volunteer recruitment proved to be very challenging. In response, in fall 2019, we began moving the WIN program from a volunteer-led one to toward more indirect promotion. This turned out to be very advantageous given the current pandemic that we're in. We offer several promotional materials for distribution to aging adults who may be at risk for food insecurity. However, we know the importance of meaningful face-to-face promotion, so we still offer in-person programming options for when it is safe to do so. The WIN Guide is the WIN program's core promotional item. It is a comprehensive booklet that describes food assistance, provides application information, and discusses some nutrition tips. These are distributed by Extension, churches, home-delivered meals, food pantries, and some medical offices. Next promotional item is a video. This summer, we created a 2-minute promotional video that talks about food assistance and how to apply. Due to SNAP guidelines, this video cannot be posted publicly, such as on social media or on websites. Therefore, we are looking for community partners willing to show this on their internal channels. We have it available via a link as well as a DVD. I'm now going to play it for you.
Between medical bills, rent, and other expenses, do you find yourself struggling to afford enough food? Food insecurity is rising, meaning more people than ever do not have adequate access to nutritious foods. In Iowa, about 60% of older adults may be going hungry because they're unable to purchase the food they need. The Iowa Department of Human Services Food Assistance Program is available to help those who are food insecure. It provides financial support to buy food and non-alcoholic beverages that are sold to be eaten at home, as well as plants and seeds to grow your own food. The money arrives on an electronic benefits card, or EBT card, that looks just like a standard debit or credit card. Food assistance can be used at a variety of places in addition to grocery stores like Schwann's, farmers markets, Meals on Wheels, and convenience stores. Just look for the EBT sign at various food vendors to determine if they accept food assistance. Call the toll-free hotline 1-855-944-FOOD. That's 1-855-944-FOOD, and someone will help you apply immediately. You can also apply online. The Food Assistance Program will help you purchase nutritious food that will keep you healthy, strong, and independent. Call today.
In addition to the guide and the video, we also have a 3-part display board series. These can be displayed at a variety of local organizations and locations serving an older adult audience. These display boards are designed to address the myths and barriers often cited for not applying for food assistance. Our final promotional item is a prescription pad. Healthcare providers have a unique opportunity to identify older patients who may be food insecure. These pads provide information about the benefits associated with food assistance and application information. The prescription pads are intended to be distributed to older patients by physicians, nurses, dietitians, and other healthcare providers, as well as social workers. These are available for distribution, so I have my contact information at the end of this, so you can always reach out to me for these materials. Our most popular in-person program is Win Bingo. This activity discusses how SNAP helps older adults meet My Plate recommendations, informs them about health benefits associated with different food groups, and low-cost ways to meet these recommendations. An often unknown use of food assistance is that it can be used to buy plants and seeds to grow your own food. Our gardening programs explains this benefit and offers a matching game that focuses on container garden vegetables. We also have a DVD on how to start a container garden. The reason why we focused on a container garden is because many older adults may be living in retirement communities and or apartments that do not have large yards or access to your typical garden. So a container garden is a more hands-on approach that they can take and manage. The other reason why we focused on container garden is even those who are residing in their home may have physical limitations that would limit their ability to maintain a traditional garden. During both of these sessions, participants receive recipes that use container garden vegetables that have been tested for taste, ease of preparation, and are lower cost. The minimum amount of food assistance an eligible person can receive is $16. Often people think it's not worth the time or effort for $16 a month. This hands-on activity supports information that we present in the WIN guide and helps illustrate to participants how much nutrition $16 can actually buy. Since 2013, the WIN program has reached over 9,000 older adults. Nearly one half of these have been reached since the COVID-19 pandemic started. We have referred 168 older adults for help with applying for SNAP and trained 117 volunteers. WIN is increasing awareness and understanding of food assistance and enhancing their awareness of malnutrition risk. As I said earlier, we are always looking for community partners to help us distribute our outreach materials to at-risk older adults. If you're interested in receiving these materials, my contact information is provided at the end of this presentation. The final program I'll take time to describe is Stay Independent, a healthy aging series. Stay Independent was designed based on the nutritional needs assessments that I've been conducting since 2010. We launched this program in 2017. Although the initial Stay Independent sessions were focused on nutrition and wellness, the long-term goal is for it to be a holistic aging program. The target audience is adults aged 60 years and older who are community residing, such as living in their own home, residing with their adult children, living in a senior apartment or a retirement community. It's not designed for those who are in skilled nursing facilities or assisted living. We do have those who are in their 50s who are choosing to take part as well. The objective for each session is to increase participants' familiarity with the topic being discussed and their likelihood of making the recommended changes that are discussed. Stay Independent is framed around whole person wellness. The whole person wellness model includes 6 dimensions of wellness: physical, emotional, spiritual, intellectual, occupational, and social. According to this model, physical wellness recognizes the importance of regular physical activity while encouraging nutrition and diet. Emotional wellness enhances one's ability to form interdependent relationships. Intellectual wellness assists people in expanding their skills, and social wellness supports better communication with others in making of healthy choices and helping one's community. Underlying all of these aspects of wellness is financial wellness, even though it's not officially part of the whole person wellness model. We are moving towards our long-term goal of making Stay Independent interdisciplinary and holistic. We will be launching 3 new finance-based lessons and 2 family life lessons in 2021. We've also added additional nutrition and wellness sessions that were in addition to the original 4. Today, I'm presenting data that we've collected from fall 2017 to through spring 2019 for the original 4 Stay Independent sessions. These original sessions have reached, at this time, had reached 341 older Iowans. After each session, participants complete a post-pre familiarity questionnaire asking about their familiarity with the topic lesson before and after the lesson, and the likelihood of making one of the recommended lifestyle behaviors that was discussed in the class. Participants have been mostly white females, age 81 years and older. Familiarity for each of the recommended behaviors discussed increased significantly from pre to post as shown in this slide. Similarly, the majority responded that they were very likely to make the recommended lifestyle behavior after each lesson they attended. In 2018 and 2019, we added 2 additional nutritional wellness sessions based on feedback from participants. If you think back to the social marketing theory, part of that is, assessment and revision. So this is what we were doing. These included cooking for 1 or 2 and maintaining brain health. A lot of older adults are newly widowed and don't know how to cook for 1 person, or they're empty nesters and don't know, how to take those recipes and make it for 2. Another topic that emerged of interest was brain health. The cooking lesson provides tips on how to prepare simple, easy, healthy meals for 1 or 2 people. The brain health lesson provides an overview of the mind diet that has been shown to lower the risk of dementia. Participants for these programs have been mostly white females, but have been younger at 71 years and older. As we saw with the original 4 sessions, there was a significant increase in familiarity from pre to post for both cooking and brain health. The majority responded they were very likely to make the recommended lifestyle behavior changes after each lesson. So what our outcomes are showing us is that Stay Independent is successful in promoting familiarity with the lifestyle behaviors that are placing older Iowans at risk for malnutrition. Additionally, it's resulting in participants being more likely to make recommended lifestyle changes. Due to COVID-19, we have converted all of our nutrition and wellness Stay Independent lessons to an Adobe Connect format. And we plan on offering these sessions online later this fall and this winter. In conclusion, extension programming is improving the health and well-being of older Iowans throughout the state. We're increasing familiarity with health-promoting behaviors. We're helping increase the awareness of food assistance to help older Iowans be more food secure. And we're increasing the likelihood of older Iowans to make research-based lifestyle changes that will lead to long-term wellness and independence. For more information regarding the programs I have discussed today, please feel free to email me at the address that's on this slide. You can also visit our Human Sciences Extension and Outreach website for additional information.